நிலக்கரிக்கு பேர் வாய்ந்த நம்ம நெய்வேலியில இன்னொரு லேண்ட்மார்க்கா நம்ம நெய்வேலி ஆர்ச் கேட்டுக்கு எதிரிலேயே ஒரு உலகத்தரம் வாய்ந்த மல்டி ஸ்பெஷாலிட்டி ஹாஸ்பிட்டல் வந்தாச்சு. SNS மல்டி ஸ்பெஷாலிட்டி ஹாஸ்பிட்டல். கடலூர் மாவட்டத்திலேயே நம்ம நெய்வேலியில மிக பிரம்மாண்டமான மல்டி ஸ்பெஷாலிட்டி ஹாஸ்பிட்டல்.
Hi, Doctor. Deepthi this side, the host of today's session.
Hi.
Could you please introduce yourself?
This is Dr. Sheeba Jayaraman from SNS Hospital, Gynaecologist, Consultant Gynaecologist, Obstetrician.
Okay. So starting on with today's session, my first question to you is, how does diabetes during pregnancy affects the unborn baby's health, and what are the risks associated with it?
Diabetes is of two types, and these two types, they differ in the way which they affect the pregnancy or the unborn baby. There is something called the type 2 diabetes. When the woman is a diabetic prior to her pregnancy, or it is called gestational diabetes, that is a diabetes which occurs or you find it first during your pregnancy. So these two entities have different influence on the unborn baby. If it is a type 2 diabetes or the woman is a diabetic prior to her pregnancy, it has a huge health issues on the unborn baby. Like we advise the women to strictly control her diabetes prior to her pregnancy, because there is something called the free radical injury. When there is a very high uncontrolled blood sugar levels, it will affect the embryology of the fetus. The fetus, that is the baby inside the women, it will have a lot of anatomical features, abnormalities, say like cardiovascular abnormalities. It might affect the heart of the baby predominantly, or it might affect the brain of the baby. It might affect the spinal cord or the backbones or the neural tubes of the baby. And it can also affect the kidneys of the baby, the eyes of the baby, etc. It can affect any organ of the baby if the diabetes is not under control prior to her pregnancy, 3 months prior to her pregnancy. So if it is, this is the case with a diabetes which is occurring before the planned pregnancy, if it is not under control. If it is a diabetes which occurs during her pregnancy, or if it is found out only during the pregnancy, then in that case, there is a chance that the baby can go bigger in size, and the baby can land up with lung maturity deficiency, or the lungs, they might be respiratory problems after the baby is born, the baby's breathing problem after the baby is born. It is more predisposed for preterm deliveries. Preterm delivery in the sense, she might be prone for delivering the baby prior to her due date. So there are two entities, and these two entities affect the baby different. And that is why we need to have a close monitoring of the baby, and we need to protocol the pregnancy as to which type of diabetes she belongs to.
How can the patient manage the diabetes during pregnancy to ensure the health and well-being of the baby?
Okay, management of diabetes. It is not the patient. I shouldn't be wrong if I'm going to correct you. It is not the patient who will manage the diabetes. It is the team, doctor's team, that is going to manage the diabetes. The only thing the patient has to be is like, we need the patient to be highly compliant. Compliant in the sense, we give her certain charts to monitor her blood glucose. We give her certain dates to come and review. We give her the scan schedule. So only thing is, she has to stick to the individualized protocol, and she has to get the advice from the doctors and the team. It's a teamwork. Like, it should be the gynecologist, diabetologist, and the nutrition therapist. So it is a teamwork with which we manage. And of course, the patient has to stick on to the diet chart which we give, has to calculate the calories. If at all there is any doubt, she has to ask the team. and she has to come for regular antenatal checkups. And one thing which I personally advise all these women is uh, keep an eye on the fetal movements. That is what we call the fetal kick counts. And keep an eye on your sense of well-being. If at all you don't feel well, you feel giddy often, you feel that the baby is not moving well, you have to report to us immediately. This is what we expect from the patient as such. Management of diabetes is a very different scenario, and there are a lot of things which we manage the diabetes. What we expect the patient to do is we need the patient to be more compliant with this, understanding, accept. The key is just to accept that she's definitely diabetic. The key is that she has to get treated properly.
Okay. So moving on to the next question. How often should the patient monitor the blood sugar levels during pregnancy, and what is the optimal range that she should opt for?
Yeah, this is actually a very good question. So the frequency with which you monitor the blood glucose level, that is how many times should I monitor the blood glucose level? It entirely depends on how well your diabetes is under control. So if the diabetes is poorly controlled, if it is a type 2 or a type 1 diabetes, that means the mother is a diabetic prior to her pregnancy, then we suggest her to monitor the blood glucose daily. Daily, in the sense, we give her a chart, we ask her to buy a glucometer at home, we give her a chart, and we monitor the chart daily. She has to monitor her fasting blood glucose for 1 hour after the breakfast, 1 hour after lunch, 1 hour after dinner. And if it is a newly diagnosed diabetic, then the case is different. We monitor the blood glucose every 2 weeks. And while monitoring every 2 weeks, we take plasma glucose. That is from the lab, we need to check the blood sugar levels. So it varies between the control of diabetes and what type of diabetes she has. So it varies between a minimum of 7 times, a maximum of 7 times a day to a minimum of once a week. It varies. It has to be individualized according to the patient.
Are there any diet restrictions that I should follow
I haven't answered one of
during
your.
the pregnancy and to manage the diabetes?
And see, the average blood glucose, the control of how are you aware of your control of blood glucose? That was one part of your previous question, right? So the fasting blood sugar should be less than 95, and the postprandial blood sugar, that is 1 hour after your lunch or your breakfast, should be less than 140, or 2 hours after your lunch or your breakfast should be less than 120. Anything beyond this is not a well controlled diabetes. So the on an average, the mean blood glucose, that is anytime you measure, it should be on an average of 80 to 100 milligram per deciliter in pregnancy. In pregnancy, the values differ from that of the non-pregnancy. Dipti, can I have your next question? I missed your question.
How will the delivery be affected by diabetes, and what kind of delivery should she opt for?
Delivery, okay, delivery being affected is we need to follow the diabetic mother for 10 months or nearly 9 months, and we need to analyze what other complications she might have. So it is not exactly the mode of delivery. Mode of delivery in the sense whether it is a normal delivery or a cesarean delivery. That is called the mode of delivery. The time of delivery is that whether she is going to deliver on the date of her given date of her, that is what we call expected date of confinement or expected date of delivery. Is she going to deliver on that date exactly, or we're going to deliver the baby 3 weeks prior to her expected date of delivery? This all depends on how well the baby is inside the mother. And the second thing is how well the blood sugar is under control. If it is an uncontrolled diabetes, or we give her high dose of insulin to control the blood sugars, we prefer terminating the pregnancy, delivering the baby at 37 weeks itself. That is well prior to her expected date of delivery. Because one thing that complicates the pregnancy is the unexpected intrauterine fetal demise. That is, the baby dies inside the mother's womb because of very high blood sugars, especially during the last 3 weeks of a pregnancy. And we don't want that to happen. So, uncontrolled diabetes or diabetes complicated by some fetal complications, we prefer delivering the baby at 37 weeks. And if there are any other complications on the blood flow or the weight of the baby is too much reduced, like what can happen in your diabetes, which can occur prior to your pregnancy, we deliver even at 34 or 36 weeks. So the baby will be fine. That is not an issue. It is like, when do we safely take the baby out of the mother? That is more important. If it is a very low glycemic, like if it is a very low blood sugar levels, which is very well controlled with drugs, and it just needs metformin or tablets, she is just controlled with medical nutrition therapy, then we take the pregnancy to her delivery date also. So regarding the mode of delivery, whether it is a normal or a cesarean, like you have to decide based on the patient, based on the baby. Like if it is going to be a 4 kg baby, then if it is a baby which is very less than 2.5 kg baby, or baby with some blood flow abnormalities, or more than 4 kg baby, she might end up with a cesarean section. Or if there are no other complications for the baby is fine and good, we always prefer to have a vaginal delivery.
Okay, so moving on to our audience questions. Uday is asking, "Hi doctor, I am newly married. My wife has a sugar level. Can you suggest anything to her?"
Yeah, a high sugar level, in the sense, I would like to have whether it was a fasting sugar or a postprandial sugar. When you feel that any sugar level in a non-pregnant women, a greater than any sugar fasting sugar level, if it is greater than 110, or any postprandial sugar level which is greater than 140, I would better suggest to do a HbA1c. That is something called the HbA1c, which can tell you whether how your blood sugar was under control in the past 3 months. If the HbA1c is more than 6.5 and you are planning for a pregnancy, I wish you consult a doctor. If the HbA1c is less than 6.5, you can very well plan the pregnancy. So this HbA1c will help us estimate the sugar controls over the past 3 months. And if it is more than 6.5, we generally advise the women or the couple planning the pregnancy to just put down the sugar levels, bring down the HbA1c to less than 6, and then plan for pregnancy.
So Anshu Khandewal is asking, "Doctor, I have high sugar level. Please suggest me what good diet should I follow?"
Okay, diet is something. See, I we give you, see, when it comes to diet, is one part of keeping the high blood sugar levels. When it comes to diet, you have to see what we suggest a portion split analyzed meals. That is, it is not the it is not what you take, more than what you take. It is when you take it and how much you take it. You split the meals. You spread the carbohydrate diet over several meals. Like if you're going to have heavy meals, like major 3 meals, instead of having major 3 meals, you just split it into 6 meals per day. Split up the carbohydrates. And when you choose carbohydrates, choose complex carbohydrates, like what is there in vegetables like potato, sweet potato, banana, etc. Rather than simple carbohydrates. Simple carbohydrates are nothing but sugars, the bakery products, the confectionaries, chocolates, sweets, and ice creams, and baking. See, avoid all these simple sugars which will bring your blood glucose suddenly to a higher level, and choose complex carbohydrates which is seen in our lentils. It is seen in our pulses, millets, and all the starch fruits and vegetables. Choose complex carbohydrates, and split up your meals. Take small portions quite often, and take lot of protein diet, like protein, and avoid Avoid all the deep fried uh, vegetables or fruits or whatever. Avoid deep fried items, avoid bakery items. Take a lot of fruits and high fibers like beans, lentils, and sprouts, and egg can be taken. And even meat, when you take, you need to take lean meat rather than red meat. And you can take fish, you can take, and avoid too much of cheesy stuff, and avoid all the junk foods. That's it.
Okay, thank you, doctor. This was very informative video by Tejas. Thank you.